Okay. Yeah. So now I'm starting my 2 minutes time.
Have you gone through the
No,
patient
I have
information?
started. I have started my 2 minutes
Okay.
reading time.
Ma'am?
Yes, I'm reading. I'm reading.
Okay.
Okay, I'm starting my timing. Yes.
Okay. Have you gone through the scenario?
Hello, I'm Dr. Prajakta. I'm one of the Doctor Part 3 MRCG student appearing for the exam. Yeah, I have gone through this case, this patient information leaflet regarding abdominal hysterectomy, and here I would like to take the questions.
Okay. Can you explain the principles and the benefits of the enhanced recovery program?
Yeah, so enhanced recovery program is a generic model of fast recovery. It has been aim for minimizing the hospital stay of a patient by reducing a physiological stressor and optimizing the patient's health. Optimization of her health to avoid organ dysfunction. This helps in managing. This needs to be followed in all elective surgical cases. The next part is the principles of enhanced recovery program. The principles of enhanced recovery program aims to minimizes for the patients. The benefits are it optimizes the medical condition and reduces the physiological stressor associated with the surgery, which leads to early return to normalcy, a short hospital stay, and there are less number of readmissions associated with this pathway. For hospital, it optimized or minimal utilization of the resources, and it is more cost effective as per the hospital is considered. So with this things, it is a very good pathway if followed for elective surgeries, especially in gynec surgeries.
Okay. Have you gone through the leaflet? Do you want to do any changes in it?
Yeah.
Fit it with the
So
principles?
I had gone through the leaflet which is mentioned here regarding abdominal hysterectomy, and I would like to mention about the leaflets, the strengths and the negatives, and then I will discuss the summarize it. So
Okay.
here, this leaflet is about a patient who is undergoing a abdominal hysterectomy. So the aim of the leaflet has been mentioned, but it has not been crystal clear mentioned, and it has not been highlighted here. So
Okay.
aim needs to be mentioned in a crystal clear points with highlighting that. So it has been mentioned, but it needs to be mentioned very clearly.
Okay.
Uh, then regarding the points, the presentation and clarity. The presentation is very simple. They have mentioned in a patient friendly language. The jargons are not being used here so far as, uh, but can be made little more attractive. Can use colorful bullets or question or answer format. So that needs to be mentioned here. Mm, Validity has not been mentioned. That is the source of the leaflet. They had only mentioned the abdominal hysterectomy, what needs to be expected in enhanced recovery pathway, but they have not mentioned the source of the leaflet, so that needs to be mentioned here. Creditability and currency. So the date of publication and date up to which this has to be continued, that is the currency which is not been mentioned again here, and the creditability. So no conflicts of interest. No details of the author has been mentioned here. So that needs to be mentioned here. Uh, Along with that, the format is very simple. Clarity, presentation, which we had mentioned, and the format is foldable also,
Okay.
which is of A4 size. If you will see it combined, so that is for a very good foldable format which can be carried in the uh, purse of the patient. Regarding the presentation, one more point I wanted to say here is, it is only given in one language, so can be made into multiple languages so that the other language personnel also can go through it. So with this thing, I think that the leaflet is having quite a good points. Each point needs, now coming to the each points, what we need to expect here. So when it comes to principle of the patient, I mean, sir, enhanced recovery pathway. So it starts from the community. Here it has been mentioned, it starts before admission. So it starts from the community, and it starts quite prior to the surgery, not in weeks. So basically, here we need to explain patient will be the part of the it will be he will be the she will be the center of the care. Patient will be given patient information leaflet, consent needs to be signed. We will discuss the pain, and here adequate information regarding the discharge will be discussed with the patient. uh, Optimization of her medical condition, optimization of her BMI, smoking, and exercises needs to be informed to the patient, which has not been mentioned here in detail before admission. So that needs to be mentioned along with the drug review. So these are the first principle which needs to be mentioned clearly in the first point. Then admission to the hospital, or at the on the day of the admission, which here they had mentioned that the patient will be admitted a day prior. No, patient will be admitted one day on the day of the admission. Fluid and complex carbohydrate uh, molecule will be reloaded 2 hours prior to the surgery in elective cases. No enemas will be given to the patient, and no bowel preparation will be mentioned. But here they had mentioned that the patient will need enema, and the bowel needs to be mentioned. So those points needs to be corrected here, which has not been mentioned here. So that needs to be corrected. The correct information needs to be given here. VT assessment and antibiotics prophylaxis needs to be mentioned, which they had mentioned, but they had only mentioned in risk of stockings. It can be according to the assessment. They might need low molecular weight apparel. After your operation, so after your operation they had mentioned, but during operation what needs to be mentioned is not mentioned here. So far as minimal access surgery, regional analgesia, no tubing or minimal tubing like nasogastric, drains, catheter only for the stipulated time, adequate fluid supplementation, and avoiding hypothermia. These are the principles while doing the intraoperative management, which has not been mentioned. Can be mentioned in a patient friendly language here. Mm, After your operation, they had mentioned that the points which has mentioned here, they will be intravenous fluid, catheter, tubing, which will be there. Yes, they will be there, but that needs to be removed as early as possible. That is decanalization, encourage hydration, encourage early mobilization, and not to and we need to give them adequate pain relief, but avoid opiates. Okay, that is very important. And once they started tolerating orals, they can be uh, start on orals as early as possible. And no plenty of painkillers as per the body requirement needed here. So those points need to be mentioned very clearly, along with avoiding opiates, which needs to be mentioned here. They had not been mentioned here, so that needs to be mentioned in a crystal clear manner. The days after your surgery, after your operation, so here actually they will be advising you to mobilize yourself, which has been mentioned, but not slowly. They needs to be mobilized as early as possible. Make them comfortable by giving them painkillers, effective, and injectable low molecular weight heparin according to the risk assessment that needs to be given. Mm, Catheter will be removed as early as possible, which needs to be mentioned here. So that all needs to be mentioned here. So the days after your operation, this is creating a confusion. So during operation and after the procedure, that can be mentioned clearly here. At the time of discharge. So this is the last point which needs to be mentioned, that when she will be, according to the planned discussion of discharge, patient can be discharged with details of signs and symptoms when she needs to report, with 24-hour contact details that needs to be clearly mentioned here. Mm, Okay, and any stoma or any catheter care, if there will be, that can be discussed here also. So these are the options, these are the points which we need to mention, and with these points, writing down in a crystal clear manner, with naming the name of the trust has not been mentioned, the name of the hospital has not been mentioned in the bullet points. With these points, I would like to suggest a new format with these changes for this. Uh, Patient information leaflet of abdominal hysterectomy with enhanced uropathy. So these are the points which I need to mention.
You add, want to add anything?
Uh, that much as of now I am getting.
Any mention about follow up? You
Yes,
told already. You told about readmission.
follow up. Yeah. So
Any
regarding the
warning
follow up,
signs like that?
yeah, I told it after 20 minutes. She will be given details about when to report, when what are the signs and symptoms. So 24-hour contact details needs to be mentioned, and the care will be handed over to the community.
Yes, ma'am. It's very well done. This thing, ma'am. The definition also you explained so well, and the changes you have made, that's so good. The aim is to have a good hospital stay, satisfaction to the patient, as well as the patient will have a quick recovery and the shortest possible stay in the hospital, and the hospital cost also will be less. And the physiological recovery of the bowel function also is good, as early fluid is taught, and everything you got to explain, ma'am. And as you said, it starts in the community. The GP and the community midwife, they will be taking important care. As you told, you have told about the allergies, sorry, smoking, um, control of BMI, and the other conditions like controlling the asthma, diabetes or hypertension, anemia, correction of anemia, all these can be done actually. That also, if you can add that also, ma'am. And the patient's, what the patient is already having, the medications, everything will be reviewed by the a team of members will be there, including the anesthetist, and along with that, along with the anesthetist, there is a specialized nurse will be there. They'll be recording everything, and they'll give all the, as you told, the discharging plan, the time of stay in the hospital, everything will be explained to the patient. And as you told, the admission will be on the day of surgery. That's a very good point. And enema is not necessary. That's also super. You have explained, ma'am. And patient will have a, unless the patient is a diabetic, the patient can have carbohydrate drink 2 hours before surgery, and the eating can be stopped 6 hours before surgery, and the patient gets admitted on the day of surgery, and the tight fitting stockings and the given IV fluid will be given, and that and all. And you told there is no nasogastric tube. And you also mentioned about regional anesthesia, ma'am. That's a very good point. And avoiding plenty of painkillers. And I don't know how to explain the multimodal analgesia, use of
You
to
can,
avoid not to avoid opiates in the post-operative
yes.
period, so that the bowel function will recover early. Patient will take fluids as she desires, and walking about everything. And also the VT risk assessment that also explained, ma'am. And, mobilizing that and all, the stockings, everything has been explained. And you see, as you said, it is not the colorful, uh, can be given in the form of boxes or question answers. That's also a good point. And catheter can be usually as early, it will be removed.
Decannulation, yeah, decannulation.
Yes,
So,
yes, ma'am.
yeah. Yeah. So this way actually you are going to present. You please remember that your answer should be in a very structured way. It should not go haywire. If at all you had missed out on something, make a point that you will bring back those points and include it in your answer key. This is very, very important. So this is actually what I had presented. Now let's go through the answer key, what I had mentioned. Okay.
Okay.
Yeah. Okay, so enhanced recovery is a generic model of care in elective surgery. So do not miss out on this elective surgery designed for fast track or rapid or accelerated recovery care. So aim will be to optimize the care and resulting in reduction in stressor response to the surgery that reduces in physiological stress response, organ dysfunction caused by the surgery, which facilitates more rapid recovery, shortened length of stay. Principles of ERP for patient. Okay, it is for the quicker recovery following major surgery, shorter hospital stay, no increase in readmission rates, and early returns to the normalcy. For the hospital or the trust, it minimizes the hospital staff, so it is more cost effective to the hospital. These are the components of or the principles of enhanced recovery pathway, which start from the primary care, pre-operative, admission, intraoperative, post-operative, and follow-up. So referral from the primary care optimized. So we will go through this afterwards. Now we will read out the leaflet what they had mentioned. Okay, so coming to the hospital for abdomen. Now this is actually critical appraisal of the PIL. This can come as a different clinical governance task with any of the patient information leaflet they might be giving you, where you might be needing to critically appraise the patient information leaflet. Always remember that what are under what headings you are going to appraise the critical appraisal of patient information leaflet, aim of the leaflet. So here the aim has been mentioned that the coming to the hospital for abdominal hysterectomy, but it is not crystal clear mentioned and not bold enough. Okay, which can be missed out very easily. So aim of the leaflet has been mentioned, but I wanted it to be made more bold and more clear. Validity. Okay, validity, that means the source. What is the source? Whenever there will be a leaflet, the literature from which you have derived that leaflet needs to be mentioned. That is validity, or the source of the leaflet needs to be mentioned, so that we can check whatever information they had mentioned is authentic and is accurate according to the resource or the sources which needs to be mentioned. Clarity and presentation. Clarity and presentation basically is overall presentation, which means the language, the presentation, whether it is simple language, jargons, clear, it is a very simple presentation which you can make more eye catchy by using more colors, more pictures. Question or answer format can be used in multiple colors, multilinguistic. Okay, so those all are the presentation, but a simple presentation can also be eye catchy. The language is non-medical and there are no jargons being used here. Creditability. So what is a creditability? The details of the author and the conflicts of interest, whether it has been there or not. Currency is basically the duration, the date of publication, and when the date of revision will be there. And format is foldable, whether the foldable and can be carried out easily during in the purse needs to be mentioned. So these are the points which has been mentioned here. So there are patient in the PIL is having a strengths also, but there are certain weaknesses which needs to be gone individually now. So individually now we are having a PIL which you can mention, which you can read it out here. Okay, so which you can read it out here, and at the same point what are the principles of the patient information leaflet, sorry, enhanced recovery pathway, you can incorporate at the same time. If you think you have not uttered previously, you need to mention those points now also. So here I had mentioned at this point, but then means simultaneously I had combined both the points together and explained how we need to mention here. So with clear aim, source of credibility, few changes are here. Pre-operatively, it starts many weeks before and not a week before. Along with that, what has been expected during pre-operative period is patient is the center of this pathway. Discuss patient information leaflet of ERP and consent needs to be discussed. Discuss adequate pain relief and discharge date. Pre-anesthesis checkup. Optimize medical condition if it is there. BMI, hypertension, drug, DM, diabetes. Smoking needs to be addressed. Exercise needs to be encouraged, and drug review needs to be done on the day of the procedure. Of complex carbohydrate loading along with the fluid can be considered 2 hours prior to the surgery. No bowel preparation. Assess risk of thromboembolism and antibiotic prophylaxis, which has not been mentioned here. They had mentioned differently. Okay, before admission. A day before admission they had mentioned need edema, they had mentioned stop eating and drinking from midnight, they had mentioned, but which needs to be mentioned here. Mm, Perioperative, that is admission on the day, encourage oral fluids and complex carbohydrate loading diet 2 hours prior to the surgery. No need of enema. Assess the risk of VT and surgery. Surgery not mentioned here, so we need to mention what we need to be expected during surgery. So far as during the surgery, it will be minimal access or transverse incision, which I had forgot to mention regarding transverse incision. Regional analgesia or anesthesia. No tubings or avoid tubings as far as possible. Avoid drains. Avoid hypothermia and adequate fluid supplementation throughout the procedure. That needs to be mentioned here. Post surgery, not plenty of painkillers, only adequate painkillers just to make them pain free, so that we can encourage early mobilization. Adequate hydration needs to be discussed here, along with the points which they had missed out. Decannulate as early as possible. That means remove catheter, remove drains, IV cannula, and avoid opioids. But adequate pain relief needs to be contained here and needs to be discussed. Once the patient is fit, had tolerated orals, mobilized adequately, pain free, we can discuss the discharge and discharge with the 24-hour contact detail, red flag signs, when to follow, and that needs to be mentioned in the discharge summary also. And the care can be handed over to the primary care. So with these changes, I will recommend to apply this in this format, and we can share the new patient information leaflet of enhanced recovery pathway, what is expected during abdominal hysterectomy. So we need to discuss all those points in this case, and with that we can start go through the domain wise scoring. So communication with the patient and families. So what are the domains being tested in this question? Have you written it down? No. There are 4 domains. Only information gathering is not there. Communication with ERP pathway in abdominal hysterectomy, PIL appropriateness. Okay, so whether the communication which has been mentioned in the PIL is appropriate or not. No, it was not. You need to make it appropriate. Offer PIL as written information format, which we had offered. Contact details in PIL for pre-surgery and post-surgery communication. Okay, so during that in the ERP also we need to mention the contact details be when expected during the discharge. Okay, at the time of discharge or at the end, you can mention the details of the emergency contact details, when and where you need to report with telephonic conversation. Communication with colleague, explaining. So communication with colleague means when I was interacting with Dr. Manikam ma'am, that is my communication with colleague. Okay, so explaining the ERP principles, ERP components in a logical sequential, advantage of ERP, clear agreed management pathway detailed in her notes and in her communication to GP. That means discharge, once we had discharged, that needs to be documented and handed over this care to the primary care. Give feedback on the leaflet by adhering to the general principles of feedback, by commenting on both what was good as well as what could have been improved. So that we had done. Optimization of care or pre-existing conditions. Enhanced recovery delivers efficient admission to hospital prior to procedure, along with system to support prompt return to normal physiological process. Wherever necessary, there will be clear process in place to ensure that if patient deviates from prescribed path, yeah, this point is very important, then we may have to stop enhanced recovery pathway and we need to come back to the routine pathway. Okay, this needs to be mentioned, which we have not mentioned or I have not mentioned, that
Oh,
needs to be mentioned. Okay, shorter
yes.
period of immobility, dehydration should be discussed as a means of further reducing the risk of venous thromboembolism, and the competent candidates will have a clear idea of ERP. So, with this and applied clinical knowledge, appraisal of PIL. Leaflet, constructive comments, good and bad. Enhanced recovery process benefits for the patient. Logical approach. Use of language and jargon will be applicable in this case. Limitation of giving leaflet rather than discussion. Okay, so we will have limitation while discussing giving this patient leaflet to the patient. We need to mention the changes. Application of their clinical understanding and underpinning the conversation with example of components of enhanced recovery pathway throughout the patient journey. Appropriate care in abdominal and not vaginal or lap hysterectomy. The limitation of candidates' knowledge by not discussing any significant detail of anesthesia, elements of nursing or physiotherapy care, which are outside the curricular. Okay, so we just need to focus on that leaflet rather than discussing about the type of anesthesia, type of care, physiotherapy, all those points should not be discussed. We just need to be pertaining to the enhanced recovery pathway. They expect that much only here. Okay, so with this, we will be stopping recording of this.
Thank you. Thank
Okay,
you.
then we will go to the next one.